I'm really glad to be here. I must say that Alicia has been the key element in um, providing us with the topic for today. Um, I have taught and written about pancreatitis for a long time, and it's kind of a common sense topic. But I need to get rid of the idea that whatever is common sense for me is common sense for you guys, because I know that pancreatitis is quite complicated. And just because I speak the language of pancreatitis and how to treat it doesn't mean that everyone has learned it, right? Like it's really like a language. Medicine and healing is like language. We learn it and then it gets stuck with us, and it's good, and we can help our dogs. But the reason why I'm here is that I want you to be empowered. I want you to be able to make decisions alongside your vet. I know that many of you complain that you can't always get the right information or the information that you would like to hear, or sometimes you feel that your dog is given too much medication and drugs. And I'd like you to navigate through veterinary medicine with confidence and empowerment. So, um, pancreatitis. I have prepared slideshow again. And I will start with just a few minor details about where pancreas is located and what it is and what it does and all that stuff. So I'm going to share screen again. And the first section and the first slide here is a simple drawing with the location of pancreas. The pancreas is kind of in between the liver, that is kind of pushed towards the diaphragm. So think about the diaphragm as barrier between the lungs and the abdomen, and the liver is pushed towards that. And then there is stomach and pancreas in the second kind of layer, going from the front to the back. And then behind that is spleen. So you can see that the pancreas is quite pushed towards the liver, and also it's really close to the diaphragm. And this is important to remember, not only for the next second or two, but for the whole presentation, because it will be an important element in how to prevent pancreatitis and how you can see whether your dog is predisposed to this really serious condition. So I'm going to give you another slide. I will not give you tons of slides, but I will give you some, because it's always nice to have visual for the visual. Some people like to listen, some people like to see. Pancreas, pancreas reminds me, but in anatomy classes, we got a chance to obviously see pancreas in the real form, and also in surgery. You see pancreas, we see pancreas in surgery. It looks like a sponge that is really dense, or it looks like really kind of like it looks like a rubber element made from these little rubber pellets, right? And they're kind of stuck together. So it looks like there are these little lobules, or these little parts of the pancreas that kind of are hugging together. I'm just trying to think what else it would remind me of visually, but that's probably as close as I can get. It has it has several functions, but it has two main functions. Believe it or not, pancreas is not only responsible for digesting food, it's also responsive or responsible. My English sometimes is funny. It's also responsible for hormone production. So first we'll look at the digestive enzymes. The digestive enzymes, there are 3 or 4 main enzymes. And they're mainly for digesting protein and also some starches and fats. So trypsinogen and chymotrypsinogen are the protein digesting enzymes, then amylase and lipase. But there's one trick to it, you guys. If you think of pancreas as a digestive gland, what do you think happens, or how does it happen that the pancreas doesn't digest itself? Because it has full capacity to actually digest itself if things go wrong. And that's actually when how pancreatitis happens, especially the acute pancreatitis, when the enzymes get activated outside of or inside of the pancreas. That creates inflammation. I'm going to go back to the function though. So I said exocrine or digestive enzyme production, and then hormone production. And hormones are, you most likely know, insulin. Insulin is hormone that enables sugar to go in the cells. It basically, it decreases blood sugar, but it also allows or enables sugar to go in the cells and serve as a form of energy. If insulin is missing, then we have too much sugar in the bloodstream, but the cells are starving. So this is super important to remember, that insulin allows the sugar go in the cells and nourishes the cells. So it's not just that we have high blood sugar in the bloodstream and that's damaging to the body in diabetes, but it also is, and the main problem is that the body starves of energy, the cells starve of energy. The next hormone that pancreas produces is glucagon. And glucagon actually increases blood sugar. So it's almost like the opposite, right? It's yin and yang, black and white. They act opposite. Usually when you have, let's say, teeter-totter, and one person is not sitting, there's only one person sitting on it, there cannot be the balance achieved. And the glucagon and insulin, they achieve the balance. And then there is somatropin, and somatropin regulates the insulin production. So you can see that actually the hormones that are produced by pancreas are mainly made to metabolize and regulate sugar levels, okay? Now, there's another really cool function, and you go like, what the hell is he doing with baking soda here? Well, I tell you why I put this picture in. I put this picture in because pancreas produces sodium bicarbonate. And what it does in the body, it actually neutralizes the acids and the acidic food that comes from the stomach, right? Like we know that there are stomach acids and they dissolve the meat and the bones and all that. And when it's all done in the stomach, and when the stomach is finished with its job, then you need to neutralize the acid, because otherwise it would damage the lining of the intestine. So the pancreas is such a clever biochemical factory that it actually makes sodium bicarbonate and it neutralizes the acid. Isn't that absolutely incredible? Every time I go into anatomy and biochemistry of the body, I'm completely perplexed and amazed and blown away how wonderful the body is and how it all evolved. Like we live a miracle every single second of our life and our dogs. And when you feel down or when life is not going well, just imagine how amazing pancreas. Just the body is amazing, but I mean. I am going to show you another picture. You'll go, what the heck is he doing, or why is he showing crazy glue? Well, I wanted to explain in a little easier way or simpler way how the enzymes kind of maintain its integrity and do not digest the pancreas in a healthy body. The enzymes are packaged in little pockets or packages or bubbles, whatever you want to, blisters, whatever you want to call them, that are called zymogens. And the zymogens basically protect the enzymes or prevent the enzymes from getting activated inside of the pancreas, right? But if there's inflammation or some sort of insult to the pancreas, let's say a surgeon is really rough and doesn't really handle it very gently, then these enzymes get activated. Zymogens basically, they burst, and then the enzymes spill inside of the pancreas and cause inflammation. So that's one, not the only, but one of the causes of pancreatitis. There are also enzyme inhibitors. And why did I put the crazy glue here? Well, because when you have crazy glue in a little vial, it doesn't activate, right? But as soon as you spill it and you spill it on your fingers, you're done. It activates, and that causes a problem. So think about the zymogens as the packaging for the enzymes, for the crazy glue inside of the pancreas. Of course, pancreas doesn't have any crazy glue, but I want you to remember that it's super important to be kind to the pancreas. And we'll talk about how to prevent pancreatitis and how to make sure that it functions properly and that we don't go into the crazy glue state. Now, another way of kind of remembering this activation of the enzyme is activation, inadvertent or unwanted activation of fireworks, right? This picture is actually from New Zealand. I found it on the internet. There was some sort of storage or barge with fireworks, and the fireworks basically exploded. They activated without being really timed, and the whole disaster happened there. So, obviously we don't want our dogs to have fireworks inside of the pancreas, nor we want the crazy glue to activate, and that's why we need to take precautions. Now, there are several forms of pancreatitis, or two main forms of pancreatitis. One of them is acute, which can be life-threatening, and the other one is chronic. I will talk about them in detail. I will talk about diagnosis. Just remember the acute can happen, and the onset can be very sudden and quick, and the chronic is kind of smoldering, and usually it's not as dangerous, but it can actually lead over time in destruction of the pancreas cells, which causes insufficiency or lack of production of the digestive enzymes. There's one really important element that I want you to remember, not just to prevent pancreatitis, but also prevent diabetes, because as I said, pancreas produces insulin, and insulin regulates sugar. And if we don't have insulin, there's too much blood sugar in the body and not enough sugar in the cells. The pet food industry, in my mind, is the entity that is the most responsible for dogs with pancreatitis, and the commonness and incidence of pancreatitis rising. I've never seen a dog grazing right here. If you have, let me know. But I have not seen coyotes or wolf grazing in a wheat field. I've seen pigeons, and I've seen maybe some farm animals. If they got out of the pen, they would definitely graze there. But I don't think that wolves or canines of any kind would actually choose grain. And pancreas is not very well equipped to digest complex carbohydrates and starches. It does have amylase as an enzyme, but it is not as powerful to digest complex carbohydrates as it would be in some herbivores. So dogs have not evolved to digest complex carbohydrates. And when they get a lot of grain and kibble and processed food that is heated and hard to digest, the pancreas gets stressed. And when it gets stressed, the crazy glue may activate, in quotes. I will use that term because it's easier. And when it gets stressed, also the pancreas gets inflamed and will lose the ability to produce insulin. The cells that Langerhans cells, that's a hard word to pronounce, that produce insulin actually will be destroyed. And that's how diabetes happens, or at least one of the forms of diabetes. So processed food, in my mind, is one of the main causes. And I know that many of you still feed kibble because it's convenient or it seems to be less expensive. I always try to convince as many dog lovers as I can to stop feeding processed food. Stop before it's too late. Stop before you regret that you did it in the first place. Because I've seen so many people beating themselves up when something serious happens. And I don't know any human doctor, I repeat this often, I don't know any human doctors who would recommend processed food and say, the way to achieve health and the only way for you to eat is to eat processed food. It's ridiculous. And we should actually stop suggesting it in veterinary medicine. And most of you, or many of you, know that there are strong financial ties between the pet industry and the veterinary industry. And it's unfortunate because most vets I believe that most vets kind of would not be feeding processed food if they weren't brainwashed in veterinary school. And I have a lot of respect for my colleagues because most of them are doing an amazing job, and I blame it on the school system and the misguidance of pet food companies. Of course, some vets also know that they have to pay mortgages and business loans and all that stuff. And pet food brings a lot of income, roughly about 1/3 of the income in an average veterinary clinic. So if there is no processed pet food sales, there may not be any veterinary clinics because people are still not willing to pay the real price, the real cost of running a full-scale hospital, which most vets do. So this is a little bit of a rant on processed food and kibble, but I want you to take it seriously. I don't want you to be mad at anyone else because ultimately you are making the decision for your dog. And if you're feeding kibble, again, I don't want you to be mad at yourself at this point, but think about it, read more, educate yourself, and try to feed your dog wholesome food the same way our doctors recommend wholesome food for us humans. Other causes, oh my goodness, like when I was just kind of preparing and I was thinking, there are multiple causes of many diseases when you kind of look what the possible causation is. You can take a screenshot of this if you wish. You can see that there are some drugs. One of the interesting one is, for example, anti-seizure drug Phenobarbital that can cause pancreatitis, obesity, obviously infections, thyroid conditions, liver disease. That's why I promote liver tune as once every 6 months to cleanse your dog's liver. And other medication, infectious disease like Babesia, Cushing's disease, increased levels of calcium in the body. But if you feed bones, you don't need to worry because the body knows how to regulate calcium. So it's only if there's some sort of unusual hormonal disease or other disease that causes increase in calcium. Sometimes cancer can increase calcium. I am not going to talk in much length about pancreatic cancer, but pancreatic cancer is basically a different form of disease than pancreatitis itself. It is a condition when the cells, basically the replication of the cells and the renewal of the cells is altered, and those cells turn rogue and they start multiplying without control. It's a very dangerous disease, mainly because pancreas gets inflamed and also gets activated, and usually it's very, very fast. But pancreatic cancer, luckily, is not very common in dogs. So I'm really grateful for that. Now, this is all interesting, but the most interesting part is still coming. And this is something that I kind of learned in the course of working with dogs with pancreatitis. And also connecting the spinal flow to the different organs. For those of you who have not heard me talking about the connection of organs to the spine, I only will tell you that I will give you two examples and explain a simple explanation. The spine is almost like an energy river in the body, and it supplies not only nerve flow, but also energy flow, the qi in Chinese medicine, and also blood flow to the different segments of the body. And I've noticed as I was working with dogs, and obviously Chinese medicine addresses it too, and chiropractics and other forms of healing address the fact that if the energy flow congests or is stopped because of an injury in the spine or muscle, then the organ that is adjacent to the spinal segment will also be affected. I would see dogs that, let's say, have cardiac disease or lung disease, have interscapular, in between the scapular spasm, muscle spasm. And it's almost like a feedback system. You can have a problem with the lung and the shoulder blades will tighten, or your dog basically digs a lot or swims a lot and is really tight in the shoulders, and that will congest or stops the energy flow to the lungs, and the lung will get affected. There can be cough, or there can be cardiac disease, because that's very, the heart is also related to the interscapular region. So remember that each spinal segment is related to a particular organ, and the pancreas is related to the segment that is just behind the last strip, just behind the last strip. So if you run your thumbs, and I'm going to stop sharing now, if you run your thumbs along your dog's spine, and then you feel the last strip, kind of run by the last strip, everyone can do that, then go up behind the last strip, up to the spine, and you push there, that's the stomach and pancreas association point. And interestingly enough, I've seen pretty much all dogs with predisposition to pancreatitis and eventually ending up with pancreatitis or having elevated pancreatic enzymes or stomach issues, they have tightness in that particular spot. So what would actually, sometimes there's even missing hair, or there's basically a dog scratches in that area as close to the point as possible, because they know something is wrong. So the first thing that you can do is actually massage that particular area, or maybe ask a chiropractor to check what is going on, because it may be the pancreas in the stomach signaling up to the spine, hey, there is something wrong, or the spine may have gotten injured and it affects the flow of energy to the stomach and pancreas, right? And even more interestingly, when I discovered this, and I thought, okay, this is kind of wild, but really amazing, because the body is signaling that there is something going wrong. When I examine a dog and I see a really severe sensitivity in certain association point, let's say the lung point, like a dog would flinch or even try to bite me, which is very rare for dogs to want to bite, I would send them right to do an X-ray, because I would know that there is something serious going on there. And quite often I would find a tumor or some sort of serious disease. So with pancreas, what I noticed that if I take X-rays, that quite often these dogs have inflammation or bridging behind the last strip. See, this is the last strip right here. I'm gonna try to enlarge it a little bit. Can you see my screen?
The screen share hasn't quite come up yet.
You know why? Because I forgot to turn it on. Alicia, you're always so polite. You should just say, get your act together. Okay, so the last strip right here, I'm following that with my mouse. And you can see that normally the vertebrae should not be bridged like here, but there's bridging. That means that there has been a long-standing inflammation. And when there's muscle spasm and compression, the vertebrae are really getting closer, and the body tries to create this bridge to actually keep them apart, because that would result in a bigger problem. So this is kind of like a inflammatory response to friction and tightness of that spine. As I said, pancreatic dog or dogs with pancreatitis have usually inflammation or tightness in this spot, and quite often I see the bridging or spondylosis. I did mention also that this particular spot is responsible for stomach, not only pancreas. They're in one area. And dogs that have spondylitis or inflammation in that spot also are predisposed to bloats, gastric volvulus, which is a life-threatening condition. We have a blog on that too. So remember that checking your dog's spine, and especially the spot, the depression behind the last strip along the spine, is super important to prevent pancreatitis. If you see that your dog has tightness, go and see chiropractor, acupuncturist, physical therapist, massage therapist, and also you can massage that spot yourself. Not as hard as if you were massaging yourself, because dogs are quite sensitive, but you can just gently massage that area. And I massage Pax's spine often. He doesn't have any spots or kinks yet, and we also go to preventive chiropractic treatment. But it's super important to be aware what a healthy spine looks like and what happens when your dog is a little tight. When you touch your dog, sometimes the skin twitches or moves and so on. So the diagnosis. What do we do to diagnose pancreatitis? In the past, we used to use levels of two enzymes. One of them is called amylase and the other one lipase. I'm just going to show you the slide again. But we discovered that that is not as specific. And sometimes they can be normal, and the reliability of these two, you can see I put them in gray, is actually quite low. So in the past decade plus, we started using something which is called CPLI, canine pancreatic lipase immunoreactivity. And it's a test that is more specific, roughly somewhere in the 80 to 90 percentile. X-rays may show lack of detail. You know, when there's leakage of the enzyme and the crazy glue activates, that would create loss of detail. Ultrasound is much better because it's actually it can detect even relatively mild pancreatic changes. So those two green ones are the most important tests. If the CPLI is normal and your vet says, you know, it's all fine, your dog doesn't have pancreatitis, there's still about 10 to 20% chance that your dog may have pancreatitis. And you may want to choose to do an ultrasound. X-rays, just tell your vet, you know, I would prefer doing an ultrasound. I want to save some money on X-rays. And the amylase lipase is part of any chemistry testing. I also forgot to put one more test, and that is CBC, which is complete blood cell count. And that is also not specific, but sometimes we can have elevation of the white blood cells, the fighters in our body. So misdiagnoses are quite common because some vets use only amylase and lipase. But I think that there are fewer and fewer veterinarians because it's really a common standard to use the CPLI. What do we do about preventing and also treating pancreatitis? That's super important to know and learn, because you may be presented with some options that I would prefer you declining, and I will explain why. So whenever I talk about treatment of anything, I implement what I call healing cycle. And that's what nature does when it heals anything, when it cleans the rivers or when it heals environments and so on. It cleanses. When there are toxins in the ocean, nature basically uses waves and winds and sun ray to detox, right? And then all the different microorganisms and life in the ocean has to be nourished, and then everything has to be reset. And the body works in a way similar. Usually we need to get rid of toxins, then we need to provide the nutrients in the right form, and then we align the spine and rebalance the body and make the body stronger. You know what happens to older dogs and older people? That we get out of alignment. Not only with some muscles are thick and some muscles are weak. And what I discovered, actually, interestingly enough, that when the spasm and the muscle aching actually starts with weakness. That if I have certain muscle group that is weak, another muscle group actually starts picking up on that and takes the job, and that gets overworked. And then the cascade reaction happens. So if you want to maintain your dog's good and healthy spine, you will need to do some exercises with your dog, especially if he or she is a middle age, balancing, core strengthening, and all that. We are planning to have a little interview with a company called FitPaws, and FitPaws make amazing exercise equipment. But going back to pancreatitis, I'm gonna take you through the basics, and you can take screenshots. It's all good. I want you to keep these lists at home in a little folder. And when you go to your vet and your dog is vomiting or having diarrhea or not eating or having symptoms of pancreatitis, this is super important. That made me realize that I didn't talk about the symptoms at all. And I would like to tell you that, as I said, it's vomiting, lack of appetite, sometimes diarrhea, abdominal pain, lethargy, it can be shock, it can be all those, right? But pancreatitis is not the first thing that should come to mind when your dog has diarrhea. I don't want you to panic, okay? If your dog is bright and alert and happy, all good, and you can implement the diarrhea protocol. But if your dog is lethargic, not eating, vomiting, shows signs of pain and distress, definitely you have to take him or her to your vet right away. So what do we do with treatment? Usually it's good to give the pancreas and the body rest. 48 hours is just about right, maybe 24 hours in some mild cases. But if you fast longer, that may result in low protein in the blood, and it can result in some other problems. So they say that we should not fast for more than 48 hours, ideally. IV fluids and sometimes even protein supplementation in the fluids would be important. Pain control. Pain control is important in acute cases. But there are some other meds that are often prescribed: antibiotics, antacids, and corticosteroids. Antibiotics are not really indicated in pancreatitis, and most people now acknowledge that, but they're still prescribed. And what they do, they actually destroy your dog's bacterial flora when there may be already digestive upset and diarrhea and all that stuff. So in the ideal case, forget about antibiotics, and tell your vet that you would prefer not to give antibiotics at that point. Some of them may reason there may be possibility of sepsis because of the inflammation of the abdomen. Personally, I have not seen that, and I think that it's safe, especially in the mild to moderate causes or cases of pancreatitis, not to give them. And you have always an option to give them if the situation is more severe, but most of the time it's counterproductive. Antacids used to be used as well to prevent stomach ulceration, but again, that is not indicated in pancreatitis. And obviously, the old steroids that are used often in different treatments, and I don't like them at all. They do suppress the body's own healing capacity, have huge impact and negative side effects on the body. So take a screenshot of these. Make sure that you remember fasting, IV fluids, pain control sometimes, and then those ones ideally not. I do have a little bit of a protocol for diarrhea, which I also use, and I'll show you, which I also use for pancreatitis. What you need to remember, if there are elevated pancreatic enzymes, I'm just trying to get that link open. My apology. I think we'll be. Oh, can you see my browser now?
Yes.
So the diarrhea protocol and the pancreatitis protocol is actually pretty similar. And chicken 20 hours after, and then transition to lean meat, and then make sure that your dog is hydrated. Use probiotics. We have GutSense. They're non-dairy probiotics. Certified organic material or ingredients are in it. And I do not usually use activated charcoal in case of pancreatitis, but otherwise, it's pretty much the same protocol. We also do have Recipe Maker for those of you who want to start on either cooked or raw homemade diet, or want to buy it but want to understand how it's made and what you should be buying. It's a really cool tool where you can enter all the different ingredients, and you can learn about the different ingredients, and then you can add vegetables. I do promote vegetables for dogs. I think that somewhere between 15 to 30% vegetables is optimal. I like to give greens and other vegetables. Some vegetables can be cooked. Some vegetables should be fed raw, usually chop them up or process them in a food processor. Anyway, if you want to go to the Recipe Maker later, You can find it right here, recipemaker.petertobias.com. We created this free tool just because we had so many people asking for recipes, and I don't really like writing recipe books. So I just thought I'll give you the tool to make your own recipes. All right. So diet, low fat, super important. If you have a dog with pancreatitis, reducing fat is the key. Otherwise, high quality diet where I would be combining or kind of mixing for the period of recovery, meat, vegetables, and maybe squashes, about half and half. So it's a little different than the regular protocol. For a week, just give half meat, cook it, and some squash or butternut squash or pumpkin with some vegetables, and I would probably cook the whole meal. After a week, and when your dog gets second test results back and the enzymes are better, great. Then you can actually start feeding raw food. If your dog has chronic pancreatitis, that's a little trickier, and I'll talk about it in a few minutes. There is a possibility that the chronic pancreatitis will not require any other change in the diet than low fat, meaning that you will feed about 50% meat, 25% raw bones, and 25% or 15 to 30% vegetables, depending on how your dog does. But there are some other elements that I'm going to suggest for dogs with chronic and also acute pancreatitis. So going back, we have a lot of information here. I want to go through it. We've gone through the recipe maker. Pancreas is basically a chemical mega factory. It is an amazing organ that we really need to respect and look after. It also needs a lot of nutrients. If you had an experiment in the lab and and the teacher would not give you at school, and the teacher would not give you the basic ingredients for the chemical reaction to happen, what would you think? It's ridiculous, right? And unfortunately, because of soil depletion and food depletion, some of the nutrients in our food are no longer present in sufficient amount. And this is one of the reasons why we've seen such huge improvement in many dogs who get the Fabulous Four, the supplements that I give to packs and I also take, and we recommend to other dog lovers. There are 4 different groups, and many of you have heard of them. Some of you may not. I'll repeat them really quickly. Minerals and amino acids. Minerals cannot be made by the body. Some essential amino acids cannot be made by the body. They should come in food, but often they don't because agricultural soils have been not really used in a proper way. Think about it this way. If you buy the produce somewhere in New York City, it possibly came from Florida, but the compost from the vegetables and the manure, in quotes, is not going to go back to Florida. So we get constant depletion. The nutrients don't replenish enough. In the past, 10,000 years back, humans and animals lived in very different conditions, and they roamed and they got all the different nutrients. Even if you have your own garden, you will not get all the minerals and elements in there. The meat only projects the depletion from the soil because cows and other animals get the plant material that is depleted, and then the depletion basically projects to the whole food chain. So that's why we've seen such amazing changes with Greenman and the mineral support. Some of the vitamins are also needed to be supplemented because they're not sufficient, again, because of the same reasons. We have reached for a fermentation process when we make our certified organic soul food. It's, as far as I know, the only certified organic multi on the market. And I'm super proud of it because it wasn't easy to formulate. It also has some organ support, including pancreas, in the product. Gut Sense is a probiotic, and it's non-dairy probiotic and prebiotic as well. And Feel Good Omega is a sustainable source of omega-3s. Many people use fish and algae Fish and krill are unfortunately depleted, and it's a serious problem. Algae, I have not been able to find one non-GMO algae source. We originally planned to do algae oil, and we couldn't. So we actually use calamari, which is increasing your population because there are fewer fish in the ocean, and the calamari doesn't get eaten. So since the 50s, the calamari population has been having, a heyday, and it's been rising dramatically. And I use that particular omega source. So if you want to learn anything about these supplements, you can always go to our website and read what other people say. It's better than me talking about them any longer. Now, if your dog has chronic pancreatitis, but also post-acute kind of period of recovery, you want to give digestive enzymes. And there are some digestive enzymes on the market that include roughly this kind of enzyme grouping: amylase, lipase, papain, bromelain, protease. Those are the 5 enzymes that I would like you to have in your dog's digestive enzymes. I also recommend digestive enzymes for dogs that are senior, because their ability to digest food is a little lower. And I noticed that middle-aged and older dogs are more likely to get pancreatitis. Now, there's another important part, especially if your dog has chronic pancreatitis. When the chronic pancreatitis happens, there's inflammation. And as I said, it sometimes can lead to pancreas insufficiency or dysfunction or lack of production of these enzymes. And in order for that not to happen, you want to protect the pancreas and reduce the inflammation. And the reason why I put the mama bear with the 3 little bears in here is that the glandulars are the protectant for the organs, such as pancreas. What the glandulars are made of? They're made of the organ tissue, like pancreas. And when you give it, they neutralize the antibodies that the body creates against the inflamed pancreas. When there's inflammation in the body, in the system, the body goes, okay, I better remove these inflamed cells. They're not good. But unfortunately, in many chronic inflammatory processes, it destroys the organ. This is how diabetes happens. And that's why, and also pancreatic insufficiency. That's why when we have a dog with chronic pancreas inflammation, we need to provide glandular supplements. There's a company called Standard Process, and unfortunately, and I will say that, they made the decision not to allow other people sell their product because they were selling only through practitioners. So you were not able to buy these glandulars freely on the market or on Amazon. But now, finally, Standard Process moved to the 21st century, and they have their own Amazon store. And so they have actually glandular supplements for different organs like kidneys and liver, and also pancreas. The glandular supplement for pancreatic support. So look it up. And if your dog has chronic pancreatitis, despite the fact that I've been having a little mixed feeling about their decision not to really allow the product to be freely available, I'm glad that they finally did, and I've forgiven them. Because ultimately, what we should do, we should be there for our dogs and not for the marketing or business purpose. Of course, businesses have to survive, and we have to survive too, and everyone does. But I think that we should never forget who is at the top of the pyramid. And in our case, it's the dogs. And in case of a glandular supplement company, it should be also the patients, right? Not some sort of business interest. We can always find ways where we can maintain the integrity of our values and make a difference. And that's what I'm really proud of, that my team and I have been able to make that happen, even though it's never been easy, but it's fun. So I didn't show you the mama bear and the little bears. I'm showing them to you now. So remember, glandular supplements are the protective supplements for the organ. spinal alignment, if we want to prevent spondylosis and inflammation of the area that is responsible for feeding the energy to the pancreas, then we need to work with someone who knows how to align spine. I will make a little intermezzo, and if you wanted to reach out to my colleague, Dr. Lavoie in Quebec, she just called me a couple of days ago that she was given an ultimatum that she's not allowed to practice. She's a very skilled animal chiropractor. She's not allowed to practice on animals in the province of Quebec because the veterinary college has basically established a complete dominance over the industry, and nobody else can actually touch the animals in province of Quebec. So she basically has been forced to move to another province, and now she's possibly, she's kind of trying to connect with the community and see how this can be addressed, because ultimately, again, it's pretty obvious that vets do not know how to do chiropractics in Quebec. Some of them do, but most of them don't. And we need chiropractors the same way we need them in human medicine or physical therapists or massage therapists, acupuncturists. It's absolutely ridiculous. And I'm using this platform to kind of inform you what's going on. And I'm sure that it's not just in Quebec, but other provinces. I would not be able to speak as freely if I was licensed in Canada, but I had to, about 2 years ago, decide whether I'll continue doing my work freely or I will continue being a holder of my license in Canada. So I've given up my license. I'm licensed in the EU, and I can speak freely about the problems that are actually happening, because otherwise I would be actually taking chances and risking my livelihood. And that's why veterinary medicine is not evolving, because there are lobbies and pressures from different interest groups that do not have really interest for the healing field to be available to other practitioners, and that's wrong. Anyway, questions. I'm hoping that your dog will be as happy as my little dog, Pax. He's number 2, but now number 1 after Sky. He's taught me a lot. Sky taught me a lot, and I would like to pass that knowledge on to you, because I know how much you love your dog. I know how much you care. I also understand that sometimes we make mistakes that we regret, and I'm hoping that I'll be able to teach you and help you prevent these mistakes. But if we make mistakes, they're part of life, and they're part of learning, and all I care about that you do your best and be nice to yourself and be kind to yourself when you make a mistake. But these learning little episodes and Facebook Lives, I hope help you to prevent some of these really serious mistakes and help you understand that pancreas is basically just a little bit of a chemical factory, and that when it gets inflamed, that it can turn into a crazy situation similar to crazy glue being spilled on your fingers. Just kidding. But anyway, I hope you remember this. Take care, and
Excellent. Thank you so much. This is such a popular topic. It does come up time and time again with the customer care team. So we're excited to be able to present this information today. A few community questions. The first one is from Mandy. Mandy asks, is it bad to give enzymes for dogs that have GI issues, but not pancreatitis? Can it damage the pancreas?
That's a good question. In general, I would say it is. It will not damage the pancreas. I've always questioned whether it's good to give digestive enzymes on an ongoing basis to young animals, because they actually produce their own enzymes in sufficient amount. But I'm kind of reassessing digestive enzymes for middle-aged and older, and especially older animals. I think that it's okay to give, even if your dog has gastrointestinal problems, especially if your dog has gastrointestinal problems. And I also have a little bit of a story. One of our team members, Leah, her grandma passed away. She was over 100. And it was obviously really sad when she passed away. But Leah shared something with me that really stuck. I said, "So what did your grandmother do that she was doing so well?" She lived in the prairies in Canada, and Leah said, she had two medicines that she took every day: digestive enzymes and Bailey's. so, so I think that there was something to it. Obviously, since that time, I've done quite a bit of reading, and I do think that because the body actually loses the ability to produce enzymes as we age. We'll talk about it a lot in 2021, but I'm not gonna get down the rabbit hole now. Anyway, the body does need certain supplementation and support on that level, and I think that it's not negative at all. Even if your dog has gastrointestinal problem, and maybe especially because you should be giving them.
Great, thank you so much. The next question that actually comes up quite often is sometimes people ask about raw bones, and is it safe to feed a raw bone to your dog if your dog has pancreatitis?
I would say in case of chronic kind of smoldering pancreatitis, I think it's not going to make a difference. But I would not give marrow bones because they're quite fatty. Also, they are one of the primary causes of dental fractures because dogs that are strong and they chew on marrow bones, they can crack their teeth. But the recommended bones that I actually do have listed on the recipe maker are fine for dogs with chronic pancreatitis. With acute pancreatitis, obviously fasting and then very gentle diet, bones would be excluded from those.
Excellent.
And again, you have to try as well. Just see how your dog does. If your dog throws up after being given bones, then it may not be a good idea to give them. In that case, you will be probably asking, how about calcium and other minerals? Well, green mint is sufficient source of minerals, even if you don't feed bones. And if you feed bones, those bones may not be complete because of the depletion of nutrients in soil and food. Therefore, I still recommend the mineral supplement and I give it to Pax, even if he gets bones.
Thank you. And a question from Lenore. Lenore writes, great topic. My little Havanese was provisionally diagnosed with pancreatitis, but I declined the actual test. I tried the RC low-fat canned food for a while, but Elvis still had bouts of diarrhea and vomiting. I switched to homemade food and those symptoms went right away. I wonder if there's anything else I could be doing. I must say, I love the dog's name. Elvis is a great name. But what else could she be doing?
What's his name? Orvis?
Elvis, like Elvis Presley.
Elvis. Elvis, yes, of course.
Love it.
I love it too. If Elvis only knew that there were so many dogs named after him. I think it's great. Yeah.
Yeah. So she declined the CPLI test, like the proper one. Did the low-fat canned food, switched over to homemade food, saw the symptoms had relieved very quickly. Anything else that she could be doing potentially?
Yeah, I'm as much as I am for holistic medicine, I love to have a good understanding of what's going on. So I at your earliest opportunity, when you feel like, or your annual blood test, get the CPLI done, because it really is worthwhile to understand I should be doing something, because the symptoms gone and your dog is fine. I'd say in general, just detox every 6 months and give the, essential supplements and make sure that your dog's spine is aligned. And that should be all that you need to do. But if the CPLI is increased, then it's good to know, because you may need to give glandulars, you may need to give digestive enzymes, you may need to take the other steps and be a little more cautious and retake the test. So if and I can see that you love Elvis, I can feel it. I would say that if you love Elvis, get the CPLI done. If the symptoms are not there, maybe just wait, or if for financial reason you have to wait, that's another kind of part. But eventually I would get it done if you can and when you can.
Great, thank you. The next question is from Sean. Hi, Sean, one of our community members that often joins us in Facebook Lives. His question is, what do you think about Enzyme Miracle Powder with food?
I do not know what is contained in Enzyme Miracle Powder. However, I've given you the enzymes that I would ideally like to see in your enzymatic product. And I have only one comment. We never comment on other products. It's just much simpler and easier because, number one, if I don't have experience with them, how do I say whether they're good or not? I actually have some of our customers and dog lovers coming back to us and saying, my vet told me that I shouldn't be giving you a supplement, or my vet told me that your supplements are good, whatever it is. Like I think that unless I have experience with certain products, I just don't comment. It's just easier. I'm sorry, but it's just not something that I want to do. I only know that what I do and give and take is actually something that I trust, right? That's all I can say.
Absolutely. And a follow-up question for Lenore. When it comes to pancreatitis, you've already gone over a lot of the symptoms that dogs might present with. What about itching? Have you ever seen that sort of connection when it comes to, like you'd mentioned, tightness maybe of the spine and stuff? Would that cause itching in a dog?
Yeah, absolutely. So there's one really interesting part of healing, or the kind of healing that I embrace and love, that dogs quite often point to the areas that are tight, spastic, inflamed. And sometimes they scratch and it looks like there's itching, but it's actually tightness in their either spine. I'll give you an example. So if you have a dog that is tight in right behind the last rib, in the stomach and pancreas point, if you draw a line along the ribs, it'll end up on the abdomen, somewhere in front of the belly button or quite close to it. And if your dog scratches, right there, that means that the gastric point, the pancreas point, can be possibly tight or inflamed. So yes, it can be, but I would say the skin can get also itchy because of these changes in energy flow and tightness. But I would say that it's more likely that the dog is just kind of trying to fix something, right? Like, what can dogs do? They can chew or scratch when they have a tight muscle. We rub it. We rub our shoulders or our temples or our jaws, but dogs can't do that. They would, if they chew too many sticks or chew toys, or if they play with the Kong all day long, they will start scratching their neck or their jaw, or they will start scratching their tummy when the stomach and pancreas point are tight. Mm-hmm. Don't I look like a doggy when I start scratching?
I know we're getting close to time. We have perhaps one more question to round things up. This question is from Chrissy. Chrissy writes, most of the interventions I'm not sure what that's supposed to say. It says most of the interventions about care of pancreas are almost similar to taking care of dogs with liver issues. Is it safe to say we can do the same interventions for the same issues as elevated liver enzymes? And I think interventions was the correct word. I was just not looking at it properly. So what are the similarities between taking care of the pancreas and taking care of the liver?
I would say that, it never kind of dawned on me that I could compare those two treatment plans, because I kind of start with the nature of the organ. Mm-hmm. It's more two dogs. Instead of if dogs could be kind of if dog breeds could represent liver and pancreas, I would say the liver would be like a lab or golden retriever, and the pancreas would be border collie, like over the top, very reactive and responsive. The liver is a little less responsive and a little more sluggish and a little more whatever. But you're right that some of the steps are similar, but the way we approach liver disease and pancreas as a whole is quite different, because it can turn into digestive insufficiency, pancreatic inflammation of the acute kind when there is a shock, or the chronic kind when there is just, chronic inflammation that can lead to insufficiency or lack of the production. Very different beast. I would not dare to kind of compare the treatment plan, even though the dietary plan is kind of similar. I would just say that we have to be very I'm more careful when it comes to pancreas and pancreatic inflammation, especially in the short term when we discover that. If it makes sense.
Yeah, it absolutely does. I think they're all of the community questions that we have for now. But I do want to thank the community for sending in some great questions for this very popular topic, and hope that the presentation, along with our 2 companion articles on the website, are helpful information to get a grip on this very common topic that comes up with dog health a lot.
And I'm going to ask everyone who's watching the recording, which is going to be obviously posted, please share this with your other friends, dog lovers. We really appreciate it. Subscribe to our newsletter at petertobias.com, because we publish not only medical topics, but also kind of life topics and how to live good and healthy life with your dogs, and how not to let life get in the way and problems and all that stuff. So it's kind of, I mix actually my current work is a mix of holistic health blended with conventional knowledge as a veterinarian, and then personal growth and development and photography, which I love as well. So anyway, thank you so much for being part of our community. Alicia, thank you. You're always fantastic. And I'm so glad that you're actually embracing Facebook Lives and that you seem to like them. And Paula in the background.
Yeah, big thanks to Paula as well.
Thank you.
Thank you, everyone.
And give your dog a hug for us. We'll be back in a couple of weeks. Do not know what we are going to be talking about, but stay tuned.
Surprise.
Bye-bye.
Thanks. Bye.